Welcome back. It is time for morning rounds today.
Yes, we are in the thick of flu season, and instead of just trying to get through it, we are trying to learn how we can protect ourselves from it.
That's right. Physician assistant Anna Snowden from Christie Clinic is here to share what healthcare providers say we should do about that. Good morning.
Good morning.
How you doing?
Good. How are you guys?
Good.
Great. So, to be clear, we're not talking about coronavirus here.
Nope, not today. You can definitely go online, and CDC will tell you everything you need to know as far as what information we have.
Okay. But we are in the middle of the flu season now, and there's a relatively high level of false negatives.
Yes. So during this time of year, you can test patients or you can just treat clinically based on the high prevalence of influenza in the community. There is a 40% false negative rate associated with the testing. Okay. So the sensitivity is not that great. And really, with it being so prevalent, I've been treating patients just based on clinical symptoms. You know, you always have to worry about a secondary bacterial infection on top of that, but overall, unless somebody is really requesting testing, I'm not personally doing it, you know, just for that reason, because what's it going to do as far as changing treatment? If you have all the symptoms and you test negative, well, if you're high risk, I would still want to treat you anyway, you know?
Yeah, so not all providers are doing testing at all then?
So yeah, that is kind of dependent on the provider. Some providers do a little bit more testing than others. Some of our providers really don't do much testing at all and just base it on clinical symptoms, yeah.
So we always talk about the difference between the flu and a cold.
Right.
So how do we know when we have the flu?
Okay, so with the flu, you have pretty rapid onset of symptoms. You are going to have both upper and lower respiratory symptoms on top of systemic signs. So you've got your fever, headache, malaise, just overall weakness, and then your upper respiratory, sore throat, headache, runny nose, lower respiratory cough, just kind of all hits you all at the same time.
Totally.
So if,
worst.
Yeah, it is. And if that's what you determine is going on, you know, what would be what's the treatment? What do you do?
So the treatment, if you are within a 48-hour window of symptom onset, we would recommend antivirals at that time. Now that is always up to the patient. The patients that I really push treatment on are the ones that are, you know, children, older adults, and or patients that are immunocompromised or have higher risk for complications. So diabetics, people with COPD and asthma, you know, heart disease, really those patients, just because they have a higher risk for morbidity, mortality rates. Just yesterday, I had a patient come in, diabetic. She was positive for the flu, and I tested her only because she had all the symptoms and she was somewhere else and tested negative. So I kind of wanted to make a point at that time, send her off because I was worried about sepsis for her. She was not doing well at all.
All right, and it's never too late to get your flu shot.
Correct, never too late to get your flu shot. So, you know, we're still in high flu season, and I would still recommend getting a flu shot just because you are going to deal better with the flu if you actually get it.
Very good. Good tips. And then how do you know if you should go see a doctor or whether you can just write it out at home? What's the determination between whether or not you need to go in?
So really for, you know, healthy individuals that have flu-like symptoms, as long as you have no underlying comorbidities and you are 20s, 30s, you can write it out. You know, my husband just had the flu last week, so he had about 36 hours of symptoms and then started feeling better. But really, if you're concerned at all, and or if you have children at home, or, you know, have visited with anybody else that is higher risk, there's never anything wrong with going to get checked out. Or if you're somebody who has a past history of, you know, pneumonia and you get it often, I would still get checked out just because, like I said, you can have two things going on at the same time.
Just to be safe.
Right, exactly. It doesn't hurt.
All right. Good tips. All right, Anna, thanks so much.
Yeah.